Do you think health plans are essentially going to be the intermediary for telehealth? So your first visit is actually going to be with a physician that works for your payer before you get to an actual provider?
I think it's really possible. If you think through it, and the payer provider hybrid systems, big organizations that had their own insurance plan as well as a health system had it figured out a while back that the incentives were appropriately aligned for them to start being proactive, to offer these digital tools to engage in telehealth and telehealth beyond just the televideo visit, right? To think through things like chronic disease management, population health, and things like that, leveraging the best of the technologies that are out there. And the private insurers that hadn't necessarily been in that space, they took note, they paid attention, they figured out that the patients that they insured that were cared for in those health systems also did better. So they're pretty savvy. They realize if they can save money by keeping people healthier, their incentives are already aligned. Frankly, if health systems that aren't hybrid systems or aren't thinking this way, aren't careful, they're going to see a lot of their business eroded by the insurers that are getting into the wellness market. Again, it goes back to the old sick care model of healthcare. You're only going to be successful with that for so long, and I think that time has passed at this point. There are too many others that are looking to disrupt that and to get engaged and understand the overall economics and how to make the incentives work for them without asking anybody else for more money, right? You've got massive insurers that are buying physician practices to be able to take care of patients more directly. They're employing chronic disease management, remote patient monitoring, televideo visits, care coordination, and even some interesting niche cases where you've got entities that might, for example, have a retail pharmacy insurance focus in combination. I think you can probably figure out a couple of examples like that where there's been some mergers that are continuing to blur the lines, where they're also providing rare disease management to keep those patients with very expensive, very complex conditions better managed, better healthy, or more healthy, and out of the hospital, preventing the complications, keeping them healthier so that they're not having to spend the money on the insurance side of the business to take care of them when they're sick, which is much more expensive.